Hey everyone, Jordan Smith at Breathe Monitor Dentistry and avoidingbraces.com. My goal is to help you as a parent make sure that your child is getting the best help that they can possibly get, hopefully so that they can avoid braces. But more importantly, we want to see that their face grows in the right proper proportions and proper ways. So not only will they avoid braces and have a beautiful smile, but they'll be healthier in many other respects. So in this presentation, 7 factors that you can assess at home to determine if your child's going on track. I'm going to help give you, as a parent, the tools and the ways to analyze your child at home so you can see if they are indeed growing well, or if there's some things that are off that we maybe want to intercede with and to help develop before they end up needing braces at a later age. We definitely want to have the cosmetic smile that braces offer, and braces often will do that. But if we have structural issues that we're going to mention here today, you might want to get ahead of those things, as those things can be left in line and behind for your child even after braces. So many people today suffer from sleep apnea, so many people suffer from TMD and other facial pain, as well as they see relapse over time after having braces, and most of those things are related to leaving the problem intact and just trying to make it look better. So let's get into the meat of these things. I do want to introduce myself a little bit better. My name is Jordan Kane Smith. I started this practice here at Breathe Monitor Dentistry almost 2 years ago. I am a local native of Oklahoma. I actually grew up just down the line in Catoosa, and met my wife in high school. We both then attended Rogers State University in 2002, where I received my molecular biology degree in 2006. That was kind of the pre-med degree, but it consisted of way too much chemistry in my opinion for anybody. From there, I attended the Oklahoma University College of Dentistry, where I received my doctorate in dental surgery there. My advanced studies consist of LVI Global in Las Vegas, Nevada, where I have learned majority of my background in neuromuscular dentistry, physiological dentistry, as well as cosmetics and sleep apnea. And then from there, attended more education in advanced dentistry at the Facial Beauty Institute, which is where I've combined what I've learned at the LVI Global with facial growth, orthodontic correction, as well as TMD correction, which is working on the joints as well as working on facial pain. So those two institutions work really well hand in hand to help us understand more about the mouth and the face as it relates to the teeth. Teeth are oftentimes just signs and symptoms of other issues going wrong in the facial posture of our mouth, as well as the head and the neck, the joints, etc. And so my goal here at Breathe Monitor Dentistry is to look at everything that is attached to the teeth, as well as the beautiful side of the smile that we want. But if we don't have everything in tandem, normally we don't have longevity in a beautiful smile. We don't have longevity in a healthy, pain-free face. And so my goal here is, again, to now focus more so on the children that are developing incorrectly, because we can avoid so many other things that I try to correct at later ages. So much more easy when we do it at a younger state. So you as a parent being educated, knowing what to look at, what to do, and how to intercede can make such a big difference for your children that I cannot stress that enough. So I want to go into some of the causes, the reasons for change that we see with children. So when we talk about the big 3, which is on the handout that you received prior to this presentation, with the big 3, we're talking about the main habits that alter our children's facial growth that we've got to correct for, or we know we're going to not only need braces, but we're going to be trying to fight that for the rest of our lives. So with the big 3, I want to talk about the reasons that we end up not often seeing those 3 habits corrected, or I should say followed, in our children. The biggest thing here that I want to strain to you guys and stress, I want to say to you guys, is that poor facial growth equals underdeveloped jaws. If we do not have big enough bone growth of the upper and lower jaw, we are not going to have enough room for our teeth. Our teeth are genetically coded to come in at a certain size. We can't do anything to make them bigger or smaller. However, we are underdeveloping our jaws due to some really poor habits and some changes in our posture of our tongue and other things, breathing as we mentioned. And if we do not grow big enough, we are certainly going to run into issues related to lack of space, teeth being pulled, surgery to try to correct these issues. And most of the time we can avoid these things, or we can intercede to correct for these things before those types of recommended treatments are needed. So let's go into the factors of poor facial growth. We talked again about big 3, breathing, keeping the lips together, as well as the tongue in the right position in my previous handout. When we go into the blueprint for growth, it starts to bring in an even broader scope of what makes changes to our craniofacial development. Dr. Enlow, he's kind of noted as the forefather of facial growth. He wrote the textbooks on facial growth and did most of his studies in his life over how our face develops. And when we read his blueprint, as it states, the blueprint for facial growth, bone growth lies in the muscles, the tongues, the lips, the cheek, the integument, the mucosa, the connective tissue, the nerves, the blood vessels, the airway, the pharynx, the tonsils, the adenoids, and other organ masses. That's a lot of factors. Those factors are truly what makes such a big difference in our facial adaptation. You know, we used to think genetics kind of were everything. You had a child, you kind of waited until they were 10, 11, 12 to see if they were going to need braces and whether or not their smile dictated that. And we thought, well, mom needed them, dad needed them, sis needed them, he's probably going to need them too. Well, that may not be the case. Most of the time, these changes in habits can be related to genetics, but more so, most of our habits are just not being followed. We'll go into a little bit more in just a second as to why. But this blueprint is huge, and as a parent, you can affect that blueprint by making sure your child does some things correctly. So keep that in mind as we go forward. You guys make such a big difference. Reasons we change our breathing. You know, I listed some things here: allergies, enlarged adenoids, enlarged tonsils, underdeveloped nasal sinuses, I should say passages, and deviations of the septum. When we aren't breathing well, we're going to adapt, right? We're going to start breathing through our mouth, and as I mentioned in the previous handout again, we start changing as a reason of changing our tongue position and other things that are associated with our changes in breathing. But more importantly, these are things that can be altered and observed and changed. And so with allergies, especially being in Oklahoma, we know how important it is to try and treat the allergies because most kids have them these days, unfortunately, and that's making a big difference. So be sure to have your child's adenoids, their tonsils, assessed by maybe an ENT as they're aging. We can look at some of these things here on our CBCT x-ray, our 3D x-ray, to determine whether or not they have enlarged tonsils or adenoids. We always screen for that, and deviations of the septum. So if a child physically has a problem breathing, we need to get ahead of that. That's going to make a huge change in their craniofacial development. It's going to affect their teeth. We're going to have some more problems as a result of that. So we need to get ahead of those things. Diet is something that you as a parent often don't know about. You don't know that your diet, I should say your children's diet, affects how they're breathing. Who would have known? But as Dr. Weston Price here mentioned in a book called Oxygen Advantage, they write about this. Dr. Price was a dentist, and he actually studied the changes in diet in different civilizations. One here that he mentioned was he was visiting the Gaelic people living in the Hebridean Islands off the coast of Scotland, and noted that children became mouth breathers after parents switched from their natural diet of seafood and oatmeal to modernized diets of angel food cake, white bread, white flour commodities, marmalades, etc. The link there is connected to the fact that we are now eating far more acid-forming foods in our body than we are alkaline-forming foods. Now, in order to process that and for our blood to stay at a neutral pH, we have to breathe off more carbon dioxide from our lungs. When we do that to an excessive extent, our brain begins to adapt, and we now start to breathe more through our mouth because it's easier for our body to do that, to accommodate that extra breathing that we need to accomplish. So again, over time, we become more habitual mouth breathers as a result of our really poor diets of high refined foods now that we have. And that again is changing the breathing changes the tongue position, etc. starts to change the craniofacial development, and we end up with longer faces, more crowding, need for extractions, and so on. So diet is something that we absolutely need to pay attention to, and that may be something I try to get into more for you all in the future. But just wanted to mention that to you guys. Softer foods, part of that diet, again, is related to the fact that we do not eat very hard foods anymore. Growing up, we all kind of eat soft stuff. Kids love softer foods. We don't eat the hard things like grains and broccoli and nuts and things that we used to eat as a natural diet, in earlier civilizations. So as a result, we're not stimulating the muscles in the same way. Our temporalis and our masseter muscles here, as well as the others, are not being flexed the same way. Without that extra activity, our bones don't grow in order to try and assess or compensate is a better word for that muscle activity. Just like if a bodybuilder is doing curls, the muscles grow, the bone also has to grow to accommodate the size and the muscle change. So our jaws here, upper and lower jaws, are not growing to the same extent because we're not eating the same dense foods anymore as well. Let's go into the assessments. That's kind of the meat of this presentation. So knowing what you know now related to diet, to breathing, tongue position, and again, some of the stuff that I mentioned in the previous handout, we can now go into the assessments and start looking at whether or not the facial changes are occurring in the wrong direction. So we're going to talk about 7 of them. We're going to talk about breathing, the nose, the tongue, the eyes, the midface, symmetry of the face, as well as the lower chin, to make sure that we are seeing what we need to see in order to assess whether or not we need to intercede. Again, we're going to talk about breathing. The reason my practice is named Breathe Modern Dentistry is because breathing has such an influence on our teeth. It's not a common thing that we realize the connection there, but it is highly connected. Sleep apnea is connected, crowding is connected. I could probably list about 12, 15 things that are connected to the fact that if we don't breathe right, our teeth will actually be affected. So it's important that we breathe correctly. It's key to everything. So a couple things you can assess at home, as the picture shows here, is your child breathing through their mouth or through their nose. When they're breathing, it's subconscious many times, unless they're stopped up in a unique circumstance or whatnot. You're going to find out whether your child is breathing consistently through their mouth or through their nose. If they are consistently breathing through their mouth, you often see chapped lips. You're going to see more reddened gums around the teeth due to them drying out at night. And a quick thing to just assess is while they're just relaxing, watching TV, playing video games, whatever your child likes to do, are their lips together or are their lips apart? If they're normally lips apart, just resting as this, you can probably assume that they're a mouth breather, and that's going to have damaging effects on the craniofacial development. So be looking for that. If your child is a mouth breather, you might bring them by for an assessment, talk with your ENT. Let's discuss ways of trying to ensure that it's not obstructed and that they can. We just now need to work on maybe the reasons that the habit is incorrect. If we go into the nose and the NARES, a small nose, a button nose is often cute. My wife had one when she was younger, but at the same time, my wife couldn't breathe when she was younger through her nose. She had severe allergies, and so she was kind of set up from the beginning for failure. So she had to have braces as well growing up, and some other things that needed to be done for her to try to change the fact that she had pretty severe crowding. When we look at the smaller NARES, sides of the nose here, if your child has these little crescent type openings, they might not be able to breathe very well, and that might be a good tip-off that they're breathing through their mouth rather than their nose. Another thing you can do is have your child breathe in through their nose real big. And if they flex and they kind of widen as they do that, they're likely a nose breather. If they actually shrink and kind of collapse in on themselves, they're likely a mouth breather, and those are not flexed and they're not very strong there. So another tip-off. It's not a guarantee, but that's a good tip that they might be a mouth breather instead. The tongue at rest is something that changes and alters usually as a result of breathing incorrectly, but the tongue at rest should be in the roof of the mouth. If it's not resting in the roof of the mouth when the tongue is at rest and the lips are together, we're not going to get the force that the tongue creates in order to broaden and move the upper jaw out and forward. And as a result of that, if it lays down low, we're going to see the growth of the bone also correct for that. It's going to usually elongate the face, and we're going to see crowding of the upper and lower teeth because the arches are going to shrink in. They're not going to get that expansive force from the tongue. It should always be pressing against the roof of the mouth. If you want to check for some things that your child may be doing in order to assess whether or not they're keeping it there, just have them count 1 to 6, as I mentioned in the previous handout. In between each syllable, they should be putting their lips back together. 1, 2, 3. If they keep their tongue in that way and talk with the tongue kind of in that space, 1, 2, 3, they're likely more of a natural lower rest position, and they have likely a tongue thrust, which I'm going to mention in just a second. Also, you can look for a tongue tie to make sure that their tongue naturally can be in the roof of the mouth. If the tongue tie is holding it down, they probably have no chance of resting it in the roof of the mouth. Also, be very, very careful about your children sucking their thumb. When they do suck their thumb, there's 2 things that will occur. One is that pressure of the thumb, and it being narrow is going to likely cause collapsing of the upper palate, and that's going to cause a smaller nasal passage as well. But also, it trains the tongue now to stay down and low instead of raising up into the roof of the mouth. So it hits us in 2 different ways. And so thumb sucking can be very detrimental to facial growth. So definitely try and help correct that. If you need some intervention, let us know. And we have some ways that we can try and help correct for a thumb sucking habit. When we look at tongue thrust is just a change in where the tongue sits whenever we swallow. If you swallow and the tongue presses against the teeth, that's going to have some damaging effects to the way our teeth develop. And the tongue naturally should rest on the roof of the mouth. The tip of the tongue should be right behind the teeth, and that's where it should press when we swallow. And if your child swallows and they press between their teeth, you can often see it. So you can have them just smile at you big and tell them, hey, swallow for me, and see if their lips can stay apart when they swallow. Sometimes kids with a tongue thrust, they'll push their lips together tightly because they can't do it otherwise. But what you can see normally when they swallow is oftentimes their tongue will peek through their teeth, as you see here in this photo. If they poke through on the sides like this is called a lateral tongue thrust. If they poke through the front, that's called an anterior tongue thrust. That's the most common, but you can see the changes that are occurring to the front teeth as a result of the muscle of the tongue pressing forwards so commonly throughout the day. Another picture here of tongue tie. This again shows you what the tongue can't do if they stick their tongue out and it dipples in the front when they try to stick their tongue forward. That's another easy way to see that tongue tie is so strong that their tongue just cannot move around as it needs to, and that's going to change craniofacial development. Let's talk about the eyes now for a minute. A couple of great things that you can look at on your child to assess whether their eyes are telling you something. So one of the first things that I'll mention here is, do the eyes droop on the outside? When we look at the eyes and we're trying to assess if things are correct, we're actually trying to assess underneath the eyes of what the bones are doing. So we have the maxillary bone, the sphenoid bones behind them, two larger bones that will show you if the growth is occurring downwards, we're gonna see these effects start to show up. So look at the eyes, look and see if the eyes droop on the outside. Is the inside of the eye higher than the outside of the eye? If that's the case, the face is likely growing down and not out and broadening forward enough, and that's the reason it's starting to droop. The second thing you can look at is the bottom of the eyes. Many kids look tired, but as you see in this photo, you see more of the bottom of the eye and less of the top. This again is another indication that the bone is growing down and we are starting to sag. The whole face is in some way starting to sag because it's moving downwards instead of out and forward and broadening as it needs to. Also look at the eyes. Are they even? We're going to talk a little bit more about symmetry in just a second, but look at the eyes. Do the eyes have, are they perfectly even with the floor, or are they a little bit drooped? And actually in mine, you can see mine, if I look straight on, I believe it's this one, is a little bit lower than this one. These can be related to what we call cranial strains, which is changes to the bone development in the base of our head here. But cranial strains can be altered given that all the bones are connected to one another. Many times we can correct for these changes in the symmetry by moving and correcting the changes in the teeth. And by doing so, we kind of put bones back to their proper position so that they're back in line. So look at the eyes and see if they are even. These are the bones that I mentioned. You can see the maxilla here in green on the left. On the right side, you can only see the outside bone. In the first picture here with the maxilla, the area right behind it in the areas of the eyes is also part of that sphenoid bone. But you can see if those aren't developing well, you're going to see changes to the facial appearance that we just mentioned. Lastly, I want to talk about the length of the face. One of the last things we'll mention. The mid-face is a huge indicator. When you measure your child, look at your child, and you put it kind of in a deeper part here, and you maybe take a ruler and you measure from here to the bottom of the nose, and then from the bottom of the nose to the bottom of the chin. Those should be about even, about a 1-to-1 ratio. As I've drawn here in the picture, you can see the blue and the blue are the matching components of the length. You can see that the red that I'm pointing to at the bottom shows you how much more vertically we are growing down instead of growing out and forward and keeping that ratio the same. I'm going to zoom in on this. This is the same child. This is actually the CBCT, the 3D component that we can measure, and you can see when I draw a little more accurate line, the green line and the purple line show the same ratio. The red line at the bottom shows you how much longer she's growing. And I drew a line on the sides here of the mandible. The red line outlines the mandible's position at the moment, the lower jaw. The blue line indicates what the corrected angle would normally be if she was more at a 1-to-1 ratio. We get more of that square jaw and the more broader face that we typically or agree on that is more beautiful in nature. So we want to be mindful of the vertical component. We talked a little bit about the eyes being level. Here you can also look at the teeth being level, but balanced growth means balanced faces. So if something is wrong and tilted and canted, we're not getting corrected growth. So look at the cant, as we call it, or slant of the eyes. You can look at the slant of the teeth. You might even have your child take a pencil, have them bite on it, and just look and see if it's level with the eyes. In this photo here of this young girl, you can see that she does not have a level playing field. One of her eyes slopes up, or I should say her eyes slope to one side, her mouth slopes to the other. You can see her chin is well off track to her right. Indications of poor craniofacial growth. You can also look at her eyes, see how much you can see the bottom of the eyes more than the top. Again, we just discussed that. That's going to be a problem. Here's a picture of a patient of ours that I traced in blue, the level area of the orbit, so her eyes are level. However, if you look at the red, you can see that the lower jaws, the mid-face, is actually canted and swinging off to one side. Something that can be corrected if we try and get ahead of it, as well as if you look at her spine between C1, C2, and C3, boy, you can see that it's angled well off to the side of the child's face. And this is something I see very commonly as we try to balance the change in the head. Normally, instead of tilting like this, we're just going to kind of correct for it by moving the head over. Something that we can help affect by just moving teeth and correcting the teeth. Not always the only thing that we can do. Sometimes we have to work with other practitioners to make sure that we're balancing things back out. But we can't leave the hard tissue intact in the wrong manner and expect the soft tissue, our muscles and other components, to not correct for those things. So we have to be very aware of those. Last thing we'll mention here on the assessments is the chin. This is the most commonly pointed out thing by parents. Most of you guys can recognize this quickly. But when the chin is retruded and we have that soft chin, that is a sign of vertical growth. We're getting more of a horizontal growth here, and we're not getting the pivoting motion, and we're not getting the uprighting, as we call it, of the lower jaw. So with children, as I show you in these 3 photos here, we can tell that their jaw, their lower jaw, is well behind their cheek. You can see that it's well behind. I know I've cut their eyes off, but in proportion to their mid-face, which is around the nose and the lips here, we can see that the lower chin is well behind. That is most often, again, associated with incorrect breathing as well as an incorrect tongue posture. Many of these children will have a retruded bite. We call it a class 2 bite, which means that their upper teeth are here, their lower teeth, instead of being here, are actually back here. And then also, we do see this deep bite, as I've shown you in the photo. If your child has a very deep bite where most of their upper teeth are covering their lower teeth, that's going to be a problem. And the longer you wait for that problem to be resolved, the harder it's going to be. Many of these cases end up in what we call class 2 surgeries, which is a bilateral sagittal split osteotomy, where they actually break the jaw and move it forward. Something that if we can correct these habits, we can correct with growth appliances, this can be completely avoided. But this is a problem that needs to be addressed sooner than later. If you wait till 12, 13 years old, this is going to be much more of a problem, even though it is correctable. Let's talk about intervention for just a minute. I'm not going to go into this deeply, but I do want to mention, if you see some of these things being off on your child, what we do here, and this is just logic in my opinion as well, when you consider these factors being an issue that's causing the problem later on, why would we wait until the problem is now solidified, the facial growth is completed, which is usually done around the age of 12? Why are we waiting for that to be completed and then trying to correct the issues at hand when we can go back, intercede earlier in your child's life and correct for these things as they grow? That's what we are doing here. And in order to do that, we want to take very intricate records. So we take 3D x-ray, we take models and pictures of your child and their teeth, and we have to actually send those off to our third-party help, which again is the Facial Beauty Institute, who is going to do a very thorough analysis, including an oral maxillofacial radiology report, as well as 3D assessments and analyzation of your child's growth, so we can determine where they're deficient, how we need to correct for those things, and then we look at the soft tissue changes, we look at the nasal passages, we look at the tongue position, we look at tongue tie, we look at tongue thrust, and we're trying to correct for these things that are causing the problem, rather than just cosmetically trying to create a better looking outcome by leaving everything else intact. As I mentioned before, leaving the problems intact can lead to sleep apnea issues later on by making a smaller airway, can lead to poorer posture, which creates neck pain and back pain, can create TMD issues with joint pain, as well as muscle facial pain. These are all things that are tied to the need for braces that are often left completely off the table. My best analogy and my favorite analogy is considering, let's say, gastric bypass. If you know anybody that was overweight and wanted gastric bypass to lose weight, one of the major components of that surgery is diet. They don't just go and change doing a surgery and help you lose weight without considering that you're eating Twinkies all day. I mean, that's something that is huge in that surgery. They cannot let the diet slip by without addressing that as well. And we all know people and famous people that had that surgery and ended up gaining weight back. And many times it's because the diet wasn't actually altered well enough that they did a temporary fix by doing the surgery, and then their diet just kind of left them right back to the same spot. We are many times doing the same thing, in my opinion, with orthodontics, where we're correcting for the smile, making it look nice. But if we don't address the reason that the child needed braces in the first place, we are going to see that same problem occur later on. It's just a matter of time. So we need to be looking at a broader scope here, which is, as I believe, going to be the way that we do orthodontics in the next 10 to 20 years. This will be more commonplace. But as it stands, we're still in some ways behind. As a profession, and in my opinion, we've got to catch up with the science that we now have at our fingertips. When we talk about growth guidance, it's something I'm going to send you guys next, and that is the difference between straight teeth orthodontics versus growth guidance orthodontics. Growth guidance is going to encompass all of the reasons that we have the problem, as well as trying to address it at the same time, not just trying to correct for the cosmetic appearance that leaves so many things in line. I've got so many patients, guys, that are actually being retreated here, have braces 15 years ago, 10 years ago, 5 years ago, and some are even 2 years ago, that relapsed and the teeth went back to the same places that they started with. And because of the habits that were never changed, because of the issues that started the problem were never discussed and never treated themselves. We've got to look beyond that. So that's what we're doing here. So when we talk about growth guidance, we talk about appliance therapy to correct for facial growth. We talk about myofunctional therapy, which includes correction of the functional habits, the tongue thrust, the tongue ties, those kind of things, as well as we look at the adenoids, the tonsils, soft tissue changes that we can also help correct. So what's next? Well, if you see some of these things that are off, if you feel like your child could use an assessment, you're welcome to call us and schedule a consultation here at Breeze Modern Dentistry. You can reach us at 393-0070. You can also email me if you have any questions. You can leave your comments below this presentation. I'm here to answer any questions you might have as a parent. My goal is, again, to help you guys be more educated than my parents were at the time. And as I should say, it's not singling them out. So many parents have no idea that this stuff is influenceable by you, by helping your child at home, by reminding them, by helping us correct for these things. If we do that together and we work as a team, your child is going to be not only better looking, but they're going to have much better health down the line. And that, to me, is the win that we all get out of looking at these things a little bit differently. I hope you enjoyed this presentation. Stay tuned. I will send you some more info, again, on the difference between orthodontic styles that we have these days, so you're better educated to make a good decision for your child. Again, if you have any questions, please reach out. Thanks for visiting Avoiding Braces. I hope this has been helpful. I hope to meet you guys in person one day. Have a great day. Thanks.